We are coming to the problem of the palliative medicine as the part of the general topic, which describe the problem of the life and death. And the palliative medicine, it's right now widely used in the system of the medical service in the different countries, in the different societies. And the reason why it's becoming the part of the bioethical procedure, bioethical modeling, is that the palliative medicine, it's the close interconnection and the influential for the psychological interception, psychological construction of the relations. If a person's life cannot be saved, then palliative care, pain relief care, social and psychological support takes the place of the struggle to save it, with the goal of ensuring a dying person worthy of. The immediate task of such a system is to protect the patient from psychological suffering, and the bioethics help, and the bioethical judgment, the way how the medical servant make this intensive palliative care, it's the result of the actually construction, the link between psychology and bioethics. Of all the problems a dying patient has, coping with pain is often the most pressing and urgent. Coping with pain is a condition for realizing one of the patient's fundamental rights, the right to die with dignity. And this type of the dignity is supposed to be considered as one of the major on different levels of implementing the palliative medicine, or at the hospice, or at the special servants, or at home of the person. Qualified and experienced hospice staff help terminally ill patients survive to the end of their lives, while maximizing physical strength, mental and emotional abilities, and social relationships, to not make dying person out of the society, to become the link between the dying person and the social need which he or she has, and also the interconnection with the social constructions and social values. Palliative sedation. Palliative sedation, sometimes termed terminal sedation, is very occasionally needed for a patient with intractable distress, often associated with agitation in the last days and hours of patient's life. The intentions of palliative sedation must always be to relieve symptoms, not to cause or hasten the death of the patient, and the level of sedation must be maintained as lightly as is compatible with control of symptoms. And here the main reason why palliative medicine become the practical part of the bioethical judgment, that's actually to control this type of the symptomatic approach, this type of the symptoms which is supposed to be lightly maintained as the part of the human being. So the families or physicians refuse to honor the patient's wishes when patients lack decisional capacity, and that's one of the reasons why bioethics also works at these conditions. Bioethics works for the conditions to protect the patient's right to have a dignity status. These are troubling findings and are contrary to the intent of the Patient Self-Determination Act, where the use of advanced directives is encouraged to protect the patient's voice if they lose decision-making capacity, because of the loss of their consciousness, the loss of the outside reality expression. If at all feasible, the possibility of palliative sedation should be discussed with the patient before it's undertaken. Of course, and in all circumstances, it should be discussed with relatives and carers of the person. Here we have also the problem on the way how to prevent the social influence from those who are from those circumstances which influence the person, from those circumstances which influence the patient. It's hard, of course, it's even hard to talk about the palliative medicine, and that's why the bioethical description of the procedure on the way how to make the influential palliative medicine, efficient palliative medicine for the patient, it's also the discussable term, it's also the discussable vision with the relatives and carriers. The main problem for the bioethics here at this level actually is to become the servant, to become the real supporter of the patient. And also not to make the patient only think as the caretaker, only think as the person who received the care. If the patient is judged to be in the last hours or days of life, artificial hydration is not necessary, as there will be insufficient time for dehydration to develop. If the patient appears to have a longer prognosis, it may be appropriate to commence artificial hydration by simple measures such as subcutaneous or intravenous fluids, or even artificially maintained nutrition. Here we have the procedure on the way how to use the medical system, the medical understanding, and the physician procedure, and the interconnection between the patient and the medical servant. Also, at the bioethical level, here at this time of the last days or hours of the person, the reason to become closer friends, to become closer relative for the patient, it's also hard to be followed, but it's supposed to be the part of the intensive work, intensive servant of the medical service and nurseries. The intention of palliative sedation must always be to relieve symptoms. It's important to remember that it's supporting of the human dignity, it's supporting actually the status of the human being. All feasible, the possibility of palliative sedation should be discussed with the patient before it has been started, the palliative medical procedure have been started. So that's why we at the bioethical level supposed to follow this rule and supposed to implement this at the practice and use this as the phenomenology on the changing of the position, changing of the awareness of the person at the palliative stage.